Okay, can you hear me, right?
Yes, yes, okay.
Thank you, Sumita. I'm Asheni Silva. I am going to continue the IoT in telemedicine and the security part. Use of IoT at a high scale in several healthcare treatments and treatment methods and equipment with communication between doctors and patients. First of all, let's see what is telemedicine. Telemedicine is a technology which allows healthcare professionals to evaluate, diagnose, and treat patients at a distance using telecommunication technology. How is enabling the telemedicine of tomorrow? IoT is ushering in the future of telemedicine, from real-time health monitoring to preventive care to empower our elders to receive better care at home. The future of IoT-powered telemedicine holds promise. There are many ways in which the IoT can help in the growth of telemedicine by providing to healthcare centers with improved quality of care. This has turned out to be better and more convenient in several in-person treatment methods. Let's look at some examples. First one is helps doctors with accessing the important data from medical devices. The doctors can look at the wounds, rash, or skin color and analyze the patient, but they can't check their blood pressure, heartbeat, or other related vitals. In these cases, IoT wearable devices play an important role where the doctors can access important information through them. Some of the healthcare centers are even developing their own IoT wearables for their patients to monitor their health. Additionally, oximeters and digital stethoscopes are the IoT devices used by the patients during telemedicine consultation and virtual meetings. Second one is real-time monitoring. Real-time monitoring technology helps doctors to get the patient's detail every second. Patients wear Holter monitor device to monitor the abnormalities in their heartbeat. Development in technology has enabled people to take care of their health with IoT and telemedicine. Third one is help senior citizens. Several elderly people prefer to stay at home in their last days in place of shifting to assisted living facilities. However, aging without any uh, assistant facilities and doing things on their own also requires being aware of resourcing like home delivery methods, home delivery meals, communities, social groups, emergency numbers, and knowledge about using certain devices. Now, let's see some some of the trending use cases of IoT in telemedicine. One thing is remote patient monitoring. Remote patient monitoring is one of the most popular terms making rounds on the IoT platforms in the telemedicine market. The entire idea behind this concept is to reduce the hospital stay, in-person visits, and the overall healthcare expenditure. It also helps the patients who are unable to reach the physicians due to long distance or illness or old age. This technology helps both patients and doctors to monitor the patient's activities and its impact on their vitals. Second one is mobile health. It is needless to say that the innovation has turned up like a boom in the healthcare industry. The utter convenience to keep track of all the required vitals of the body and get a detailed report on their smart devices is one of the advanced development in the field. The technology is integrated with the wearable devices that are connected to the application installed on the user's mobile. This helps control several critical situations where the patient requires immediate treatment. Third one is ingestible sensors. Many times, patients tend to forget the dose of the prescribed medicine or get careless about them. This aggravates the health concerns and the treatment of the cost import as well as the criticality of the illnesses. To avoid this scenario, these ingestible sensors are discovered which goes inside the human system and stay at a particular spot. Then it can detect doses taken and is based on the sensor. These smart pills also help to reduce senseless consumption of medicine, which sometimes can even turn out to be fatal or life-threatening. These ingestible devices in their advanced version are also available with a camera attached to the device, which can give the inner views of the body parts and the organs. With so many advanced applications of IoT in telemedicine, there are certain drawbacks in the field that need to attention. Let us have a look at the challenges in the industry. One thing is unauthorized accesses. If the system does not have a strong security module, it might allow hackers and the other interpolers to get access to the doctors and patients' data. Needless to say, it can be dangerous as one may have illuminated behind the access. Another one is privacy concern. If a centralized system or even a single patient device is hacked, all the data can be available for the misuse and even the hacking of the entire system. This would not just affect the patient's treatment, but could also be very risky from the investment in the healthcare industry perspective. Another one is global healthcare policies. Currently, the healthcare policies around the world are in their traditional state. In many states and countries, the healthcare centers and the government are still following the outdated regulations, which created an obstruction and implementing the technology for the proper treatment and other procedures. Let's look at some advantages. First one is lesser no-show rate. Since the patient do not have to visit the clinic in person, it reduces the no-show rate caused due to the busy lifestyle, bad weather or poor health. Second one is gives competitive edge to the company over their competitors. Implementing this technology and encouraging your patients to adopt it definitely improves a company brand name and authenticity in the regional as well as the global market. Third one is increased revenue. Since technology comes with several benefits and less investment, it usually turns out to give better ROI to companies and hospitals. Another advantage is flexibility of working. The technology does not only give the patient a convenience to access the healthcare facilities from remote areas, but it also gives the doctors flexibility of working and treating patients remotely without having to be present in the clinic all the time and make appointments. Another advantage is cost effective. The technology can increase the number of appointments in day and or scale up the patient count in general with lesser effort and less time. Also, the patient has to pay comparatively less amount of money for the consultation than the in-person visit. Another advantage is wider access to healthcare experts. Since the solution provider provides the list of specialists and physicians available for the consultation, it gives a wider range of healthcare professionals to the patients to choose from and get multiple opinions in one place. Another one is healthy healthcare staff and lesser direct exposure to illnesses. Since the physician and nurses do not have to check the patients in person, they save themselves from the direct exposure and maintain their own health. Now let us see the way secure healthcare IoT devices. Cyber security experts can take many actions to protect healthcare IoT security, including these 5 steps. First step is inventory devices. Develop an exclusive map of all assets because healthcare organizations can't secure what they can't see. Many IoT devices are brought in without a risk assessment because they provide value. Second step is follow standard best practices. Experts must follow the general security best practices for the healthcare IoT devices. Deploy devices to understand what vulnerabilities exist and monitor network traffic for anything out of the norm using behavioral analytics profiling. And also, devices and the software should be updated regularly. Third step is implement effective authentication. Employing public and key digital certificates can authenticate connections with the network, other devices, and the electronic health record system and ensure data packets are not manipulated while in transit from man-in-the-middle attacks. Fourth step is segment network. Administrators must insulate devices that don't have built-in controls. If a device must be used for patient care, admin can turn off its compatibility to connect to the internet. If the device must connect, healthcare organization can work with the vendor to identify where the device needs to connect and only allow those connections, creating an allow list. Fifth one is use the right tool. Healthcare organization can use tools that simplify IoT security. Some platforms automate the management of massive amount of data and devices and can control authentication certificates. Manufacturers have also developed medical devices tools that can identify what a device is, what data is collected from it, and where it's connected to the internet. IoT analytics platforms can help administrators to monitor traffic and approve or any connection. Now let us see what are the main vulnerabilities in healthcare IoT. Connected devices in healthcare offer many advantages. However, the same device increase the risk to both privacy and security. Some other possible risks include attacks on systems, risk to personal safety, and privacy risk. Rather than that, risk of patients' privacy exposure. The primary privacy issue is to keep the patient's personal health records confidential. Personal health records are drawn from multiple sources and they are reported directly to a e-health center. Containing personal information, they can become the target for cyber attacks, ending the exposure of private data. Another one is data eavesdropping. Generally, the health data of patients are available only to authorized owners. However, such data can be eavesdropped while flowing over the wireless link. Another one is ownership of data. Countries have laws to prevent data, but they may vary from state to state. Besides, in certain cases, such as in case with fitness wearables, many people would think that the data touched and collected is to be bound to be protected by legislation, but in many cases it is not. Another one is location privacy. Location privacy is connected with eavesdropping on a patient's location. Location privacy in WHM specifically hiding the message sender's location can be achieved through routing to a randomly selected intermediate node. Now see who is responsible for these cases. Healthcare facilities increasingly rely on the devices that connected with each other, with hospital medical record systems and with the internet raising concern about the vulnerabilities of medical devices. The major concern with this discovery was that these devices were connected to the internet through computers which running very old version of Windows XP, known for lots of exploitable vulnerabilities. Taking into account the complexity of the problem and the number of people involved, it should be tackled on all levels from individual staff members to government. Now let us look at the responsibility areas. First one is employees. There is a need to educate employees on the acceptable and the secure way of using medical devices. Currently, a lot of users practice issues stem from employees unaware of sound security practices and not from international acts to infect or disable connected medical devices. For example, employees need to realize that medical devices, even having a browser, cannot be used to surf websites or stream music. Second thing is healthcare organizations. Healthcare organizations should increase their focus on security as medical devices become increasingly connected. Once a medical device is reachable via internet, healthcare organizations need to watch out for potential hazard and the propagation of malware. They should also ensure that connected medical devices have the latest software version. Any update of the critical medical devices must ensure that it doesn't cause unknowing problems that may unknowingly harm a patient. Third one is providers of cloud services. While healthcare organization makes sure that the sensitive data is stored in a secure and encrypted manner, they do not have control over the security of the data accesses points being used to transmit the data. This creates a significant threat that increases gradually based on the number of new devices connected to the internet and should be addressed by communication and data storage providers. Fourth one is regulatory bodies. The primary concern for the regulatory bodies is the security of personal health information stored and carried through the connected devices. For this, they need to provide adequate and consistent legislation. Now let's see what can be done. Ensuring security in the healthcare IoT requires joint efforts from the providers and manufacturers of IoT devices and healthcare organizations. There are several basic security actions that can be taken out the stage of design and production of medical connected devices. First one is authentication. Manufacturers need to issue certificates for healthcare devices that validate identities to make sure only authorized users, messages, or services access to the device. Second one is encryption. Certificates create an encrypted link and allow healthcare information to be transmitted privately. Third one is integrity. Certificates sign messages sent to the medical devices to make sure that remain unaltered and aren't interpreted. These are the references I use. You can refer those references. As Sumita mentioned, we have our own YouTube channel and WhatsApp group. You can subscribe us via YouTube and improve your knowledge. And we have our own WhatsApp group which we update more recent information through that. So you can join us on the WhatsApp. Our team member will share all the links, and also we have our own Facebook. You can join with that also. For more information on this topic and other related matters on healthcare and biomedical engineering, you can contact us on these below platforms. Rather than apart from the platforms I have mentioned earlier, we are active in other platforms as well. You can get these links from your coordinator. That's all about that. If you have any questions, you can ask.
So students, any questions? So one ma'am already asked some security issues related questions. I guess from Asheni's slides, she got some ideas.
Thank you, Silva madam.
Yeah, thank you, Asheni. Thank you so much. And I guess Shobha ma'am asked some security issues questions, right? I guess Asheni's slides cleared such doubts.
Yes, sir. Yes, sir. Yeah, all those doubts are clear now, sir.
Okay, and any doubts from Asheni's side?
Thank you, sir. Thank you, madam. Now I call upon Professor Shobha Hiremat to propose vote of thanks.
Okay.
Thank you, ma'am. I, Mrs. Shobha Hiremat, take this opportunity to propose vote of thanks on this event of webinar on IoT applications in healthcare. First of all, I would like to thank Mr. C.S. Gaston Diaster for enlightening us on applications of IoT in healthcare, role of IoT in healthcare industry, IoT benefits for patient, physician, also hospitals, and even in case of health insurance companies. He talked many things different benefits with respect to devices, patients, such as reporting and monitoring, as well as keeping the data analysis and assortments, many applications related to research and end-to-end connectivity, all these things. Thank you very much, sir, for sharing your valuable knowledge on these aspects.
Thank you.
Next, I thank you, Sumita Ramdas, madam, where she explored the various concepts such as drone technology in healthcare, RFID technology in detail, like how it is used in the hospital, in healthcare industry, various variables such as wristbands, sensors, embedded devices, IoT variable technology. Really, these are the kind of uh, you can say the topics where our students now should think on, and reducing the cost, improvise design, and should made available to the common people. The common people should able to reach out these, as one of the student has asked this question. So it's now their job to bring out some devices which should be available for the common society. Thank you, madam. Thank you, Sumita, ma'am, for throwing light on these aspects. Next, I would like to thank Ashini Silva, madam. So she talked about the security aspects of IoT, telemedicine, and how IoT is going to benefit the telemedicine area. So which takes part in patient monitoring, remote patient monitoring, and even the mobile health aspects. She spoke on the drawbacks, the major drawbacks where all the engineers should think upon that, and what could be the preventive methodologies of such as segmenting the network and using the right protocols, tools, and best practices. Also authentication, encryption, and integrity. These are the aspects to be taken care while the IoT applications are devised for the medical health and in the healthcare. So thank you, Ashwini Shilva madam, for sharing these valuable information. So our students should be beneficial with all these aspects of IoT, where now they should think upon in this direction, coming up with different projects. Probably they can take up some projects related to these things. It really is going to help them out, and even the society, the healthcare society especially. So thank you all the three speakers of today's webinar. Thank you very much, sir and madams. And I thank our principal, Dr. Basaraj Katgiri sir, for his support in conducting this webinar. I thank our HOD, Dr. Raviraj Havaldar sir, for motivating us to take up this webinar. Very interesting webinar, sir, and he helped us in arranging this event, sir. Thank you very much, sir.
Thank you so much,
Uh,
sir.
I thank all the staff for taking active participation. Not but the least, all the students whose participation has made this event a very like a grand success, because it is a student who must be benefited from the event. I thank you one and all once again. Thank you, sir.
Thank you all. Thank you,
Thank you
sir.
so much.
You and your
Thank you.
team.
Thank you so much, sir. Thank you so much.
Yeah, one announcement. All participants should give the feedback as the routine thing. What we do at the end of the webinar or workshop.
Mm-hmm.
I think Umasi Madam has shared the link for that. Request all the student participants to fill that.
Okay. And one more kind request for the students, please support our YouTube channel and be part of our WhatsApp and Facebook groups in order to get the updates from us. You can support our YouTube channel by subscribe, pay a visit to our channel and get the benefits. We have shared several informative videos on medical devices as well. So please pay a visit and subscribe and support us. Keep supporting us. Thank you so much.
Thank you. Thank you.
Thank you. So what shall we do, sir? What's the next step? So you have shared the feedback links with the students, sir?
Yeah, feedback link has been shared, and we put it in WhatsApp also.
Okay.
Also, let them fill it.
Sure, sir. Sure, sir. Maybe definitely we would like to do some other webinars to your college. Maybe some new trending topics. So let's join hands together and keep in touch with each other.
Yes.
Sure. Thank you so much. Thank you so much for giving us this opportunity on behalf of the healthcare engineering team.
Thank you.
Okay. Thank you so much. Thank you so much, sir. Okay, sir. So shall we end the session, sir? Now?
Yeah.
Okay. Thank you so much.
See you.
See you, sir. Bye. See you, ma'am. Bye bye.
Yes.
Thank you.